Hi, I'm Dr. Julie Spaniel with Summerwood Family Dental. Since COVID's happened, we have to worry about dental aerosols. You know, as COVID is a disease that's spread through salivary droplets, when you're in a dental office, the procedures that we do actually produce a salivary spray of droplets. The dentistry that we've done has always been high quality dentistry. It's just that nowadays we have to do that dentistry in an area or in a treatment room where the patients are safe. Well, actually at Summerwood Family Dental, we're the only office that has done this protocol. So what I call the new standard of care, which that we should be treating our patients in an isolated room. So isolation is number one. Number two is filtration. There should be some sort of filtration unit in the treatment room. So the third part that we need is actually ventilation, and that would be some sort of extra oral evacuation unit to capture those aerosols as we produce them. We have our patients checking in virtually. They have their temperature taken, and we ask them questions that pertain to COVID, such as, have you been exposed to somebody that was diagnosed positive? Have you been feeling well? When we're in the office, we have specific places that we've designated for our patients to sit. The patient is escorted back into the treatment area, and they're brought through a soft wall, which actually isolates that treatment room from the rest of the office. When they're seated in that area, there are two built-in HEPA filters in the ceiling that are actually blowing a very light air down onto the patient, which is pushing the contaminants in the room down to the floor where they're suctioned through a special HVAC system that returns that air through the filters. What that does is it actually changes the air in the room 9 times a minute. We have a large extraction flume, which is a device like your hood over your stove. And what that's doing is it's actually sucking up those aerosols as we produce them in that room. And those rooms are each completely isolated from the other rooms. After the patient is seen and they are escorted out of the treatment area, that treatment area is now sanitized and sterilized. The process of doing this, the instrumentation and everything within the room is actually taken out and transferred directly to a biosafety cabinet. And the reason and the purpose for doing that is that we now have contaminated instruments that need to be in a controlled environment and be cleaned in a controlled environment so that things are not then transferred around the office. So when somebody comes in and they have treatment needs or they have questions, I'm actually able to share those x-rays and photographs of their teeth so that we can talk about the options, talk about the pros and cons, and help them come to the best decision for their treatment. But the most important thing in the work that I do is really thorough communication with the patients and that education. I feel like when someone walks in the office, they should feel like they're walking into a family room. So you should feel at home in this space. And that was the intent of creating it this way. I want a patient to walk out the door and think, I've never experienced anything like that. I've never had that level of communication and care and level of attention because we genuinely enjoy being with our patients.